Hi.
Hi there.
Here we go. Well, Dr. Cass, thank you so much for joining us today. We really appreciate your being here. Thank you.
And I'm really happy to be here.
Thanks. Let's begin with, how do you see autoimmunity? What is autoimmunity?
It's the body attacking itself. It gets confused. Things happen, there's interference with natural processes, and we end up attacking our own body.
And in your psychiatry practice, do some of the patients that are coming to you also have autoimmune diseases?
Well, what's interesting is that many autoimmune diseases present as a psychiatric condition. So they've come to me, I'm the psychiatrist, and if I were a regular psychiatrist, I would write them a prescription. Oh, you're depressed, here's a prescription for, an antidepressant. Or, oh, you're bipolar, here, I'll give you all these medicines. Instead, I do a complete workup. I take a history. I find out if there are any other organ systems out of whack. I will look for thyroid antibodies. I'll look for the gut being out of order in any way, leaky gut and so on, food sensitivities. And I uncover a tremendous amount. And then it's not being a psychiatrist, I'm being a full body physician.
Yes.
Which is really what psychiatrists ought to be.
Yes.
I mean, I went to medical school and I learned a lot. And what I find is that most psychiatrists just throw that away and they're just dealing with writing prescriptions. And that's because that's the way it is. That's the standard of care. I can't really blame individual psychiatrists, but it's not a good way to practice psychiatry.
That's the way that they were trained. I'm assuming that's the standard protocol. Is if someone comes in with depression, here are the antidepressants you might consider based on the individual.
Yeah, it's seen totally as from here up, and it's treatable with a magic bullet.
Yes.
And of course, the medications are fraught with problems.
Yes, yes. So autoimmune conditions coming into you, what might come into your practice? Someone comes in with depression, and what do you see in terms of autoimmune conditions?
Well, I have one case that comes to mind right now. There's this woman in my practice who was depressed, quite depressed, and she was actually had been a high-functioning financial analyst, and she couldn't work. She was just having so much trouble. She just could barely get out of bed in the morning. So I did my usual screening, which includes thyroid antibodies, and lo and behold, she had thyroid antibodies. So,
elevated levels of thyroid
elevated
antibodies.
levels of thyroid antibodies, which indicated Hashimoto's thyroiditis, which means that her own body was attacking her thyroid.
Yes,
So that's not a good thing.
yes.
So I told her, I treated the thyroiditis by putting her on thyroid medication and essential fatty acids and a few other things that I will use for thyroiditis. And at the same time, I told her she needed to do an elimination diet, which she didn't want to do. Blah, blah, let's further down. We determined she's gluten sensitive. She still didn't want to do testing for it because she was really dismissive of it. A year goes by, she's still depressed. She got acupuncture, it helped a little. Fast forward, she finally gives up gluten, calls me up. She says, I don't believe it. She said, I've been off gluten for a month and I just feel great. It works. Thank you. And then, and I run into her from time to time because she lives in my neighborhood. So I would see her and she said, I accidentally had some gluten when I was traveling. And it just knocked me for a loop. She said, you were right. And I'm great. I ran into her husband recently. He said she is awesome. She's doing so well.
Oh, is that marvelous? And the autoimmune thyroid disease was in remission.
Her autoantibodies totally went away. No more thyroid problem. She's good.
Right, so perhaps it was a combination of the medication plus the change in lifestyle. Who knows for sure? But the bottom line is the elevated antibodies killing off the thyroid tissue were gone.
We're gone. And then her thyroid was functioning fine. She's okay. She has a good thyroid. She's happy. She's not touching gluten. She wouldn't touch it.
Yes.
She's great.
Yes. How often might a patient with elevated thyroid antibodies have the elevated thyroid antibodies go down to normal by taking the medication?
Doesn't happen.
It doesn't happen. So it's likely that the change in lifestyle, along with the medication to help temporarily, it's the two of them together that likely had the impact on this particular person.
Yes, you have to look. You have to look at what's affecting the body. You have to look under the hood.
Yes.
So I looked under the hood and behind the brain at the thyroid, but then I had to look behind the thyroid to see that she had something wrong with the way she was absorbing and responding to gluten.
Yes, yes, that's a marvelous case study. There's an association when patients have an autoimmune disease for quite a long period of time, it can make them depressed.
Right.
I'd be depressed if I were suffering like that on an ongoing basis. Have you seen rheumatoid arthritis patients come in for emotional or cognitive complaints?
They're coming into me for that. They're coming into me for their psychiatry consultation.
Yes.
They have the rheumatologist.
Yes.
I said, well, what else do you have going on? Oh, and I'm looking at their hands, and
Yes.
their hands do not look very good. They look like they have rheumatoid arthritis. Oh, yeah, well, I'm seeing the rheumatologist. I said, well, would you consider, let's look at your diet. Let's, again, test, whatever, and it works to actually remove the offending foods, treat the way I treat, which is a functional medicine approach to rheumatoid arthritis. They came to me with depression.
Yes.
And you'd say, oh, well, yeah, they're depressed. Let's help them adjust to their life situation. No, the depression went away. I mean, this happens. When I say a case study, there's more than one case where this has happened.
Yes.
And people come in with all kinds of really difficult issues, Crohn's disease. And again, let's look at what is causing the Crohn's disease, not like let's treat Crohn's disease with the GI person and the psychiatry, I treat the depression. It doesn't work that way. We
Yes.
have to treat the whole person.
Yes.
So when you really treat, when you go under the hood and you really treat, solve the problem at the root level, the symptom, depression's a symptom, it goes away. And the cognitive problems, they go away because they're simply symptoms. They're not disease conditions.
Yes.
They're not in stone.
Yes. Yes. In the world of the development of autoimmune conditions, we know that there's a genetic vulnerability to a particular condition. There's environmental triggers that set them off, like the straw that broke the camel's back. And then there's often a gut issue, perhaps intestinal permeability. In terms of the environmental exposures, those can be foods, most commonly foods. Those can be persistent organic pollutants. They can be heavy metals. They also can be our medications. That when we hear on television an advertisement for a medication, it always baffles me how they can be going through all of the side effects, which if we were listening, would scare us.
Very fast.
Very fast, yes. But there's happy people in the background.
And death.
And death, right, and death. That's exactly right. But we're watching the volleyball player who's really happy and bouncing around. And right. While they're talking about death and cancers. And so in terms of the environmental exposures that may initiate an autoimmune disease, can you talk about some of the medications that have short-term value in psychiatry that may be toxic to people long-term?
Well, all medications come with a price. And in terms of short-term use, I'm not even so sure about that. Now, if somebody is very manic and they need something to bring them down, usually you do need to medicate them temporarily. That's in a bipolar person having a manic episode. But most of the time, the drugs are pretty much placebo effect. I mean, the way the research has indicated that it's basically placebo. And occasionally with very depressed people, it may actually have some value, but at a price. For one thing, they're addictive, that once you're on, it's not like you're going around craving, you gotta have your fix kind of addiction. The addiction is that you develop tolerance to these medications. Sometimes you have to keep increasing the dose or adding in another medication. So you're adding the toxic load. There is no such thing as a free lunch, and there's no such thing as a magic bullet. These are myths, okay, perpetuated by the pharmaceutical industry and carried out by physicians, which I'm trying, and you are, to educate, to not do these things, to really think more clearly. So when you have this toxic load of a drug that may actually just be having a placebo effect. What you're doing is you're taxing the liver, you're taxing all that whole complex system of how the liver detoxifies anything, all your hormones, all the persistent organic pollutants that you're breathing in, the heavy metals that you've ingested, all the poisons that we have. We're so exposed. I walked into a hotel room, staying at a conference, and just could smell the chemicals that were used for cleaning.
Yes, I've had that happen many times. Yes.
And we're exposing children to this.
What do you do if you walk into a hotel room and you smell all the cleaning stuff? What can a person do?
Make a note that next time you ask for a non-toxic room, for a hypoallergenic room, and for the time that you're there, if it's really bad, you move, but they're usually all that bad, and you ask for not to use cleaning things the next time in that room. I don't have people clean my room when I'm in a hotel, actually. That's another thing to do. And to bring in an air filter. There are HEPA air filters in hotels that you can ask for.
Yes. Hotels carry HEPA air filters. Oh, what a great idea.
Yeah.
That's a great little pearl.
I'm going to start a run on HEPA filters. HEPA just means it's a very small pore, so it really filters out the fine particles.
So you're cleaning the air so that environmental exposure is not as bad for you.
Right. So many people present with depression or cognitive problems or anxiety, and what's going on is leaky gut. So number one thing we have to do is check for leaky gut, because that is going to cause inflammation. And if you have inflammation in the gut, you have inflammation in the brain. And it's connected. It's so interesting how the gut and brain are so connected.
Yes.
And part of it is that the microbiome in the gut is actually talking to the brain through the vagus nerve. There's a direct line.
A direct line of communication, yes.
Yeah.
Yes.
And we've ruined our microbiome with all the antibiotics we're giving right from the get-go. Little babies are given antibiotics, wiping out their microbiome, or they don't get a microbiome because they're born by cesarean section. So, I mean, or populated by the, whatever's on the hands of the person who's handling them in the nursery.
Right, the surgeon or the nurse that's handling them afterwards. That's the microbiome they develop, is the bacteria on the surface of the skin of the surgeons, not mom's internal bacteria that they were pre-programmed to receive. And that bacteria is the library, if you will, of how that gut is supposed to develop.
It's messages, it's information.
Yes.
And this baby is born without that information.
Yes.
Which is horrifying. And the mom may not have such a great microbiome either, because she may have been on antibiotics, she may have been on all kinds of medication, steroids, whatever. She may have had vaccines with thiomersal in them that wipe out the gut bacteria. Or stress. Stress is going to do that.
Yes.
So cortisol does that.
Yes.
So we're in trouble.
Do you see children with attention deficit in your practice?
I do. I see a lot of children with attention deficit disorder. Their parents bring them in because they've been told by the school that they need to be on medication. In fact, in some school systems, they won't let the kid back in without the meds.
Can you walk us through little Johnny? He's brought in by his parents. What happens when they walk into your office?
Well, they know that I'm alternative, that I'm not going to, that they've come to me because they know I'm not going to write them a prescription. So I take a history. What is this child eating? It's usually a boy if it's ADD. It's more common in boys because of the hormones. Testosterone tends to create more hyperactivity and ADD, but the girls as well. So let's say Johnny comes in. What is he eating? Oh, sugar pops. Or I don't even know what kids are, whatever the awful cereal of the day is with milk, and he may have a dairy sensitivity. So he's not getting a good start to the day. Playing video games, not playing outside enough, although there's a lot of pollution out there. But nonetheless, getting exercise, socialization, interaction with others, these are all the things that kids need. The other thing is, by the way, who said little boys are supposed to sit in school all day?
Yes.
Did you sit in school all day? Quietly and
if it was available back then, they would have given me IVs of Ritalin.
I figured as much, because creative people who are going to be successful, If you look at successful creative people and you go back to their childhood, they were ADD, ADHD, problem kids. What were they? They were being kids. They were being boys. They were expressing themselves. They were bored with this ridiculous way of teaching. We learn by interaction, by example, by being with people. This whole factory of kids sitting in a row.
Right.
It's like the assembly line in a factory, like little robots.
Yes.
Terrible.
It's like the difference between the forest in the Amazon with all of the diversity that's there, or after it's been clear cut and they plant rows of one kind of tree. So there's still a forest there again, but it's not. There's no diversity, and that's what our education system is like. We're all in rows, sitting properly. We have to be quiet, sit in a chair.
Be quiet. Can you imagine learning by being quiet?
Yes.
That's
yes.
bizarre.
So what happens to these boys when they're brought into you?
Well, you see, my job is to help them conform, which is kind of scary. I mean, I think they should be in a different kind of school, but there aren't many schools that do that, and the public school system is what it is. So we have to adapt. And still, some of these kids do have what's called reward deficiency syndrome, low dopamine. Either they're producing an inadequate amount of dopamine, or their dopamine receptors aren't as active. There are not as many of them. And usually the father was that way, and if I take a history, and I look for a history of alcoholism, ADD, depression, anxiety, I really look for that kind of history, gambling, bipolar illness. A lot of that's related. So it all has to do with the neurotransmitter system, particularly dopamine. So when I've taken my history, I may or may not do lab tests with kids. I'm less likely to do lab tests right off the bat, but I prescribe a healthy diet. Take out the junk, take out the sugar, take out the white flour, take all the white stuff away. Start to eat whole foods, not whatever pops from a package. As I said, I don't know what they're all called, but they're
like Pop-Tarts.
Pop-Tarts, that's what they are. But horrifying. This is supposed to be nourishing, a growing body, growing brain. Not.
Right.
Recommending a good protein breakfast, eggs, vegetables whenever you can get them in kids, and sometimes you can't. So make a shake with greens, with fruit powder, with protein powder. They have to get enough protein. They need protein to grow. So to make muscle, to make everything. So changing the diet, adding in shakes when you can, or if they don't like the breakfast they're given, they can have a shake because it's convenient, because mom sometimes is really busy in the morning and she may have several kids and blah, blah. So they change the diet, decrease the amount of time spent sitting with video games or watching TV, have more interaction with the parents, and then put them on supplements. And I had this one case, this was great. A woman came to me, she said, I don't know what to do. The school wants me to put my son on, he's 12 years old, they want me to put him on meds. I don't believe in them. What can I do? I said, here, and this was just a woman that was working in a place that I was consulting to. She wasn't even a patient. So I said, try this. And I gave her some essential fatty acid, omega-3 fatty acids, and my Focus product, which contains tyrosine, phenylalanine, and some cofactors that actually help to make dopamine. So I gave it to her, and I said, take 2 Focus in the morning and 2 of the Super EPA, which is my fish oil. So that's what she did, and I saw her a month later, and she said, it's amazing. He said, what's so good is that when she went back to school and spoke to the teacher said, see, I was right. He needed to be on medication. He's doing great. End of story. That is really end of story.
Yes.
Because he did do very well.
Oh,
just doing
marvelous.
that. Because she was giving him a fairly decent diet, but he did have that reward deficiency.
Yeah, it's really marvelous.
Yeah.
What percentage of autoimmune patients that come into your practice are women?
Most of them.
Most of them?
Yeah. And it has to do with hormones. And it's a kind of funny thing when I say hormones, because I wrote 8 Weeks to Vibrant Health, and a lot of it is about hormones. And men are always like, oh, I can't say that. Oh, I can't talk about hormones. She'll be mad at me.
Right.
Because
she'll go into a rage.
She'll kill me. No. But the truth is, we have hormones, and women have cycles. And there are changes in mood related to women's cycles. And when they become menopausal, it's another cycle. You know, the perimenopausal women, it's like having PMS all the time. Men, in fact, do have a cycle, but it's a little different. And testosterone doesn't have the same impact on mood that women have with their hormones. Estrogen is a very moody hormone. And rather than making it political, it was a real time, and maybe it still is like politically incorrect to talk about hormones.
Not here.
But not here. And so I really want to emphasize that. It's an important topic. Men need to learn about women's hormones just as much as women need to know about women's hormones. And there's no need to live with that kind of anxiety and depression that goes with hormonal shifts. And the hormonal shifts are made worse these days by all the pollutants in the air and in the water and food. So we're actually poisoning ourselves. There's a lot of inflammation. The messages coming out of the hypothalamus to the pituitary to the organs are just not clean signals anymore.
They're altered because
They're
the
messed up.
environmental exposures are binding onto the estrogen receptor sites, and so and those chemicals are called endocrine disruptors. They're disrupting the hormone system.
Exactly. And so women are disrupted. Girls are disrupted. We're having premature puberty. We're having little girls, very young girls, as young as 3 years old, with puberty.
Wow.
Because of the estrogens in the water. So this is so serious. This is why everyone has to filter their water. You cannot rely on your city water supply. You have to filter it, and don't drink it from plastic bottles because plastic leaches phthalates, and phthalates are xenoestrogens. So we're poisoned on all levels, and we can barely keep ahead of it. And I'm very saddened by all this because when I talk about heavy metals and persistent organic pollutants, phthalates, we've made them. Human beings have made all this. I mean,
I know. And
it's horrifying. I am chasing, it's like I'm chasing after the pollution, and trying to clean up the person faster than they're getting polluted. So you have to have filters. You have to have filters in your house, filters on your water faucets, and your water system, in your shower. So if you have whole house filtration, you're in better shape. So that's that rant. And as far as the brain becomes inflamed. All of this inflames the brain. So I'm talking about endocrine disruptors. I'm also talking about brain inflammation because all of this stuff inflames your brain. And an inflamed brain gets anxious, depressed, even psychotic. The brain is an organ. And when it's not working properly, it has symptoms. So it doesn't. The solution isn't talk therapy or Prozac. The solution is, well, let's look at this symptom and see what it means. And let's do some testing. Let's get a history. Let's see what's going on.
Well, that's very comprehensive. It's a comprehensive overview. So if I'm hearing you correctly, people come to you because they have some type of brain dysfunction, whether it's anxiety or depression. And what you're doing is you may give them something to help them quickly with their symptoms, but you're looking at the whole body, and you begin with an overview looking at the trilogy of autoimmunity. You're looking at the gut. You're looking at the foods they're eating. Is there inflammation there causing the intestinal permeability that sets up all of those symptoms they're getting?
Yes.
That's marvelous. We pray that more of our psychiatrists can consider looking for what's the trigger that sets off the symptoms they're coming in with while they're trying to help their patients feel better.
And by the way, thank you. That was a great summary of what I do. I wanted to add something because you said that I give something temporarily. I don't want the implication to be that I medicate them temporarily. I don't. Because what's really wonderful is that the amino acids, vitamins, and minerals that we give actually address the problem more directly, and we get really faster results because the antidepressants really take weeks to work.
Yes.
And a lot of it's placebo effect. And that's kind of led by the side effects. You have a side effect, you're feeling nauseous, or you have stomach aches, headaches. So many things happen, so many side effects can occur from the medications that you think, oh, it's really working, and you believe you're having an effect. But if somebody is anxious, not sleeping well, kind of wired and anxious and depressed, they have a serotonin deficiency. So what do? I give them 5-hydroxytryptophan or tryptophan with some cofactors like B vitamins, particularly B6. Give them some magnesium because that chills you out too, and it's also good for depression. So these, giving these things, these amino acids and other nutrients in the right amounts and building it up, you can build them up pretty quickly. It works.
Yes.
They feel better. So I don't have to turn to medication much of the time. And people that are really, really, if they're seriously manic, they're going to go to a hospital, and they'll be treated there, unfortunately. And I've had to take people off of meds after they've gone in the hospital, been put on very high doses of medication. They come out like zombies, and then I have to do the work of helping them to gradually get off the medication, well, as quickly as I can. But you can't get off medication quickly because it causes other problems.
Well, Dr. Hyla Cass, thank you so much for joining us today and sharing your world of information with us.
Thank you for letting me. This was great. Thank you.
Yes.